a lot. Okay? After she uses the contraceptive, when she gets her period, it's too much.
If I came from doing choco,
yes,
then I use Yasmin, the next day I'll see periods.
Okay. She says after she's done with intercourse, she uses the Yasmin. The next day she gets her periods.
No, how you use? You use regular or no?
No, I just use after sex. Then I
not like this. This wrong. You must take a regular, okay, from period every day. Every day for 21 days. Otherwise, not use.
Also, in this month, how many Yasmin have you used? We cannot count, eh?
No.
It's not advisable, and you should stop now. Okay? All right. The next question: what causes heavy bleeding monthly and not sometimes? That was your question. Like sometimes you bleed too much, and then sometimes there is no bleeding. What causes this?
You take any drugs, any birth control, nothing. Suddenly heavy bleeding, suddenly normal. Okay, we must check. We must check ultrasound to see uterus, endometrial thickness. If there is any problem, cyst, to know what is the cause.
Also, abdominal pain. She suffers from abdominal pain a lot. What could be the cause of abdominal pain?
Many causes. We must check.
And I went for ultrasound in Bata. They didn't think, but it's too much.
Nothing in ultrasound?
Yeah, they didn't see anything.
Okay, we have to check again.
Check again. I will see.
Somebody wants to know the procedure of washing her genitalia as a woman.
For
washing her vajayjay.
Must use medical wash, okay? And for me, I not prefer internal wash because may ascend infection upstairs. Better to use from outside only. You can use once daily.
So doctor is recommending you can use medical or herbal wash, but she recommends not frequently and also not inside your vajayjay, only outside.
Not using
not all the time. Okay, not all the time because this can cause infection. Okay. Is it advisable to use a biget?
What a biget?
A biget, it's this instrument. It's like
a plastic with a pipe. Then
yes, I not prefer this.
Yes,
because this ascend infection, not good.
This one can make you get infection. It is not advisable.
And never to use during the menstruation, during the pregnancy. Never to use.
And never use it during your menses and also when you're pregnant. It is not good. Okay. So this one they're asking are the implants at Medinovas, Saudi brand or Kenyan brand?
No,
not Saudi brands.
Not Saudi.
Okay, different brands. When I use contraceptives, I get itchiness. Which question was this? Whose question was this? Yes, itchiness. Where?
My body.
What type do you use?
What type of contraceptive?
Any pills you have itching may allergy from medication. No, there is another hormones. Embelanol, another hormones. We can try another hormones.
Okay, how do you deal with pimples during menstruation? How do you deal with pimples during menstruation? You see the things that come out?
It's normal.
It's
sometimes
normal.
Before menstruation appear.
It's force of nature.
We can use medication from the doctor to prevent this
action on that. Okay. Do we do medical abortions at Medinova?
No, not allowed. If medical, what is the meaning of medical abortion?
Like, I mean the one that is allowed. Maybe you get pregnant by accident. And
No, this is not medical abortion. It's not medical abortion.
Yeah, it's by accident. Maybe
Not accident.
In some other countries like South Africa, Kenya, we have abortions in the hospitals.
Not allowed.
accident is like raping. Yes, like raping.
You are raped like this. Well, actually, in the whole of Saudi, abortion is allowed. Okay, not just Medinova. Okay, it's not allowed. That's why you ladies need to what? Abstain or seek solutions before you go jiggy jiggy. Okay? Yes.
Okay, please. What if you have medical problem?
Yes, this means medical abortion.
Like you don't have any other option.
Yes, that's now a medical abortion. Which, if you have a sickness or yes, they do, but not in
She must go to
and,
government hospital.
yes, only government hospital. Okay, they can do it. They can. What are they called, doctor? That one they do it. The term they use.
No, must be medical. Medical abortion means that pregnancy cause harmful to mother.
Yes.
Cannot continue pregnancy.
Yeah.
Must be in government.
Okay. So our friend there, after menstruation, she cleans with a big cleanser, and then she gets pimples and plumps. Why, doctor?
Like allergy. Okay. Better after shaving to use product to prevent this. The doctor can give you a shot.
Yes. Okay. Okay. So you go to her and tell her you need that medication. Okay. Okay, doctor. For how long is it advisable for one to see the brown period after menstruation, and is it normal to have discharge before menstruation?
Sometimes many patients like this. This have habit. Have habit. No problem. No need for medication. If we have regular, no need for medication.
So she said, please explain regular and irregular menstruation from 28 to 35 days, and after 35 days, is it considered irregular?
Who asked you?
Aisha.
According to your habit.
Yes.
Sometimes patient, how you count 35, 25, 28, how you count?
From the time I get my period,
Yes.
that's when I start counting.
Yes.
One.
Yes. Until
Until the next day that I get it.
okay. Fix it for me. Every month the same.
No, for me it's the same.
How not same? Change 1, 2, 3 days like this.
Yeah, the time it can go to the 3. From the 3, that's when I can get my period. Then I start counting from there. So to the next month, maybe I can start 5.
33, 35.
Yeah,
Change.
30 changes like
2 days, 3 days, no problem.
It's regular.
That one is rated 46.
Change 1 to 3 days. I consider this regular menstruation. But if you want to check, we must check hormones, ultrasound, and to decide if it's regular or not.
This is something very common, like you ladies. Do you know how to count your days? You do? So that's why you need to come to see the gynae. She will help with that. Okay? Alright. Are there side effects of implants after expiry? After you put implant on and you stay with it for a long time, then do we have side effects?
better to remove after expire. Because if you leave for a long time, we find difficulty when we remove.
So there are no any health side effects. You can have it inside there.
For your body, no medical side effects. But when we remove, we find difficulty.
Okay, there is no side effect, but that does not tell you to stay with that thing for 10 years. How will you stay with something for 10 years that doesn't have any work in your body? Yes, it goes deep into your muscle.
Surgery to remove.
Is it normal after menstruation to have bad odor, bad smell?
No,
It's not normal.
not normal.
It's not normal. So that's a medical condition. You need to come see the guy.
May infection.
Okay? Yes. Maybe it might be infection. Why is it that you have implant, you have any kind of contraceptive, implant or loop, then all of a sudden you conceive, you get pregnant, and you have
Who asked you?
Madam.
You already have contraceptive and get pregnant?
I was asking my mother what was the asked them. How did this happen? And then they said, no, me, I don't want to hear about this implanting. I don't want to hear about that one. Why? I conceived having.
She conceived
When she was
She conceived when
when
she
she
was
used what? Use what?
I was using Yasmin.
Yasmin, regular use?
Yeah.
Regular, not missing?
No,
I also have a friend, she was using the injection for 3 months. She conceived when she was still using the injection. So
I think something. When you take medication, sometimes when you take medication, even antibiotic, decrease effect of oral contraceptive. So you get pregnant.
You hear that? Sometimes when you mix medication, or sometimes the medication we take on a daily basis can also decrease the. Okay? Okay, why is it that men complain that after introduction of contraceptives, women get cold, like they don't want to sexually engage?
Because the contraceptive contains hormones. These hormones, especially pills, these hormones decrease desire.
Okay? It's because some of the contraceptives, they contain hormone. And these hormones, sometimes they do not align with your hormone in the system. So the desire